That is a constant diarrhea that I kept having. I would eat something, and then shortly after, I'd have to find a restroom or bathroom and have a bowel movement. Mostly diarrhea most of the time, and so I did see improvements in that. So I feel better physically and mentally as well.
Within just over a month, you just reverse your colitis.
Yes.
Hello everyone, I'd like to introduce one of my patients. Her name is Ernest. Am I pronouncing properly?
Yes.
Okay, Ernest came to me a month ago, and in 1 month he surprised me by saying that he have no diarrhea, he have no sleeping issue, he lost 15 pounds about, and he's not constipated anymore. And then surprisingly, he reversed all ulcerative colitis symptoms. His MD suggested him to take prednisone, other medicines.
Yes.
So tell me your story. What brought you here?
So I came to you, Dr. Haque, because I was going to my regular doctor and see him, pretty much annually or biannually. He put me on some medication, prednisone, and took that. It was supposed to be temporary, and it just continued. And he said I would have to probably take some kind of intravenous medicine to correct my ulcerative colitis.
It's not prednisone. It's not a medicine. It's like a stopping your immune system. It's a steroid. Right. So they want to stop your immune system so it doesn't affect any more colitis. So ulcerative colitis is basically your immune system attacking your own colon. So they don't want immune system attack anymore. So they wanna stop immune system by using steroid. And did you take that for a while?
I did take that for a while. I was taking it, and I didn't see any improvements. And so I went back and let him know that I wasn't seeing any improvements, and he wanted to put me on a different medication. And that's when I wanted to look at alternative medicine to see what else was out there for me, so that I wouldn't have to continue taking medication.
Okay. Since then, month ago, right? How many days ago you came last time?
End of February, beginning of March.
So you came to us less than 2 months, a month, a little over a month. So in a month, what are the guidelines that you followed so far?
So I followed the dietary guidelines that you gave me, and also the vitamin supplements that you gave me, and it seemed to work well. It was a little bit of a sacrifice to go on a diet that I wasn't used to. Stop eating certain foods and eating only fish and a lot of vegetables, which was good for me. I did lose approximately 14, 15 pounds in that time. But most importantly, it corrected my colitis. So I no longer have diarrhea or constant having to run to the restroom every time I would eat something. And so I did see improvements in that. So I feel better physically and mentally as well. So,
mentally, physically as well?
Yes.
So I did not deprive you nutrients that you need.
Right.
On the other hand, I actually help you not to eat the food that actually depleting your nutrients.
Right.
So I helped you to the right nutrition that help your colon regrow, so you don't have that autoimmune disease, ulcerative colitis anymore. Tell me more about that, your overall discomfort and diarrhea that you have.
That is a constant diarrhea that I kept having. I would eat something, and then shortly after, I'd have to find a restroom or bathroom and have a bowel movement. Mostly diarrhea most of the time, but that has since gone away with.
How about the constipated? You are constipated too sometimes?
If it went from one extreme to the other. If I wasn't having diarrhea, I did have some constipation.
Or constipated, either one.
Right.
Now you
I find I have normal bowel movements.
Normal bowel movements. Sure.
Yes.
Wonderful. So if you our audience who are listening, could you tell for the audience who are suffering, actually, millions of people in United States suffering ulcerative colitis, they get steroid shot, or they get steroid injection, and or through the IV. So what diet you follow that help you within just over a month, you just reverse your colitis?
Yes, the diet that was given to me was mostly vegetables, nuts, and fish.
Fish, good.
And stayed away from all the dairy. And just the fast foods and things like that. Just stayed away from.
Avoid the fast food.
Correct. And bread.
And lower down the meat quantity.
And
then bread. So you see, so wheat, the gluten, make the inflammation, and then too much meat you cannot digest at a time when you have a colitis. At the same time, the processed pasteurized milk, that should be avoided. If you get a raw milk, you can take that for no problem. and he got a lot of pure fish. I remember I told you,
Yes.
get the wild caught or you got on
Wild caught.
wild
fish.
caught fish, and then did you try some chocolate? Actually, I gave you chocolate.
I did.
So he got by your own too.
Yes.
It's wonderful. You see, if you follow the diet properly, with chocolate, and I gave you chocolate too, and probiotic, and I gave him vitamin DK, and I gave him fiber. I gave him some herbs as well
Yes.
to what heal the hemorrhoid. And did you have hemorrhoid?
Not as much as I did before, but yes.
But you had hemorrhoid.
Right.
So you see, and hemorrhoid, the blood circulation in the cell around the colon, that helps when you have a Collisonia root. So powerful. And you know, you should please try with the Collisonia root. It's very powerful. But you have to do other things as well. Not only taking Collisonia root will affect nothing. So food, lifestyle change, and get the right nutrients, and then Collisonia root with the vitamin DK and fiber. And then I gave him immune modulator. So that helps to immune system not to attack much anymore to his colon. So anything else you want to share with the audience?
No, it was a sacrifice changing my diet, but the end results I'm very pleased with, and I feel great again, and I highly recommend it.
Thank you so much. Okay.
You're welcome.